You're listening to The Health of Business, where we talk openly and honestly about what it takes to run a healthcare clinic business in BC and Canada today. I'm Danielle Boyd, and I'm glad you're here. Hello, and welcome back to the Health of Business podcast. I'm Danielle Boyd, and this episode is actually the season finale. It's not goodbye forever, but I'm going to take a couple months off. So I thought what I would do in this episode is go through something I learned from each one of the episodes that we recorded over the last year. So yeah, by the time this comes out, it will have been just over a year worth of content, which is wild to me. It feels like I've been doing it a lot longer than a year. But at the same time, it feels like this is just the beginning. So, yeah, it is just the beginning. And in order to, protect my energy and, to really continue doing this in a way that feels sustainable, it's time for a break, and that's okay. I'll probably be back in the fall 2026, with some fresh interviews, some more solo thoughts. But for now, let's go back and do the year in review. So I'm going to go through each episode and talk about something I learned from each of the guests, and from the experience of sharing each of my solo episodes. Some might be brief thoughts. I might dive a little deeper into others. I'm kind of going off the cuff with this one. I have some notes to follow, but yeah, this is just more of a recap, maybe more of a reflection exercise than anything. It's been an amazing experience. I never really thought just how incredibly connected this podcast would support, how much connection this podcast would support, really. Like, I've had the opportunity to speak with people that I've always wanted to connect with, for years of being a physio. I've had the opportunity to connect with them in such a meaningful way as a result of this podcast, which is so fantastic. So I am just so grateful that, there's people out there listening to this. This is amazing. I'm so grateful to all of the guests who, took the time to sit down with me. Especially in the beginning when there was really no guarantee that anyone would really listen to this. So I'm so grateful for just all of the opportunities this has brought me. And I'm grateful for you for listening. Honestly, it's such a joy to do this work. It's so fantastic for me. So, as I wind down for this season, I do that with a sense of gratitude, and I'm really excited to kind of reflect back on all of the episodes that we did over the last year. So with that, I am open to new guests for season 2. I've got a few people lined up for interviews for next year, for next season. But yeah, if you have any topics, any people, any specific things you want to learn about next season, please reach out. I'm always here. I'm always open. Send me a DM on Instagram. Danny, DANI.ELLE.Boyd is my handle. Or email me, Danielle at thebalancedcollective.com. I'm always here, always open to ideas, feedback, thoughts. Yeah, I'm here to chat. With that, let's dive in. So this is it 28 or 29? This will be episode 29. So we're going to do 29 things I've learned from 29 episodes of the Health of Business. So first and foremost, the first episode I did was sharing my story. The story of how, a thriving business had to pivot really quickly. That was tough. It was really an interesting process to share that story. I think sharing my story, I've learned, is really scary and vulnerable. But what it did is it opened up a whole new opportunity to connect with the community. So I think really the lesson from that one is vulnerability and sharing can really foster amazing community and connection. So really great lesson to take from that one. It was scary. That's to basically tell the world that my business fell apart it's a really terrifying thing. So I'm so grateful that it was so well received and that it opened up the channels of communication that ultimately became this podcast. So huge amount of gratitude for that one. Episode 2, I sat down with my dear friend Andrea Mendoza, and we discussed the 7 systems that exist within a business. And so really, if you listen back to that one, we equated, the 7 main systems in a business to the 7 main systems that exist within the body. And ultimately, what the big teaching was here is businesses are like bodies, right? Different systems are going to be healthier at different times than others, right? And these systems require constant tending to, right? Like a healthy business isn't just something we achieve health isn't just something that we achieve in our body. It's something that we have to continue to look after through, exercise, healthy food, good sleep, all these things. Same thing with a business. We have to tend to the health of the business, through, communication and systems and policies and workflows and checking in on people, right? There's the parallel of the business being a health, like a body. And I think it's so true. Health isn't something we just achieve and then coast on. It's something that we're constantly tending to. So I think that was a really great episode to really hit that home. Episode 3 was with Alexi Bergeron. We talked a lot about advocacy, about the education process and his story of going through school. And really a big theme that came up here is that advocacy, education, all of these things really require empathy and compassion. People carry a lot, right? We work in this system, this healthcare system, and, we're always tending to our patients, our clients, our staff. And at the end of the day, coming at that from a lens of compassion and empathy can make things so much easier. And in reverse, when we receive that same empathy and compassion for all the things that we are carrying, it just goes so much further, right? His story really is one of lots of challenges going through the school process. I really encourage you to listen to it. His experience really highlights that compassion goes a long way. So remembering that, I think, is really, really huge. Episode 4 was with Lauren Sutherland, Core Connection Physio. We talked a lot about just like the unique business of mobile physio, but the one thing that really stood out to me is that she really speaks to this need of innovation around affordability in physio. Like we've discussed this a lot on the podcast, but physio is expensive. It's not covered by government in all cases, and people need it, right? So she's created this unique nonprofit as an option to support patients in accessing physio. And so what an innovative and unique thought process, right? So I think it really highlighted the need for innovative solutions to improving affordability and access to physiotherapy. So great listen. Really, really encourage you to listen to that one. Episode 5 was with Evan Thomas. This was such a fun episode. We talked a lot about, multiple different things, but one of the big things I learned from him is there's so many fun and unique and innovative ways to go green in our clinics. We really discussed some of the like wacky things and wonderful things that he's doing in his clinic. And there's so many neat things to like recapture, instead of like throwing things out, there's so many unique ways to like recycle gloves, for example, or, like bathroom tissue, things like that, or like paper towel. That's the one I'm going for. There's really innovative and unique ways to go green in our clinics, and far more than I ever would have just like thought of off the top of my head. So that's a great listen if you're looking for interesting and innovative ways to add more like eco-friendly and green solutions into your clinic. Episode 6 was with Cassie Adams. Awesome episode. Cassie was trained in the UK, and while she says fully the NHS, the National Health Service in the UK, is not a perfect model, it's a fantastic place for us to look to as physios for where physios are working at the top of scope in other places, right, in the global community. And especially as we, here in BC really try to add things like diagnostic imaging, and working in primary care, The NHS is a really great place to look to as a model for how physiotherapists can be working at top of scope. So that was a really, really great listen for just to learn a bit more about what's happening internationally in the physio community and how we can use some of the models there to support what we're doing here in the advocacy lens for top of scope in BC for physios. Number 7 was with Brian Waltz. We talked a lot about financial literacy here. This was really important. And, his belief is that um, improving your financial literacy as a business owner is a non-negotiable. We hire staff members who depend on us to make sure that they have a living wage or that they can afford, to pay their mortgages and whatnot. And so really making sure that, as clinic owners, we are improving our financial literacy and our ability to read different financial reports and to remain in constant communication with our bookkeepers and our accountants is really, really, really important. So that's a great listen to learn a lot more about the role of financial literacy in improving our leadership as clinic owners. Number 8 was with Neil Nijar. Awesome episode. We talked a lot about like hiring for culture versus skill, which I think was a really fantastic add-on there. But the one thing that I really took away from this is he spoke a lot about physio as a service, right? It's not just a product. We're not just selling the product of physiotherapy. It is a full service. Like that whole customer experience is a service that we are providing, right? It's not just the actual needling or the exercise program that someone is receiving in the treatment room. It's the service, the environment, the way we are speaking to people, how the front desk is handling things, processing payments, scheduling. The whole thing is an experience that patients are moving through. And so not just selling it as this thing that we're delivering, but selling it as this entire end-to-end service that we are providing, not only just as physiotherapists, but as an entire team in a clinic. So that was a really fantastic listen just to really shift our perspective in terms of what we're actually delivering through the entire patient care experience versus just in the treatment itself, right? So number 9, this was a solo episode. I did this one on direct billing, right? So this was the one where we broke down what we need to consider if we are deciding to direct bill. So the big one for me here, like as I integrated and took this message away, is direct billing really is a business decision and a risk management decision, right? It's a fantastic marketing tool. It's a great add-on for patients, but it's not something that comes without strings. So really at the end of the day, if someone is trying to make the decision to direct bill or not, it's one that is a much more multifaceted decision than simply just like, oh yeah, it's easy and everyone's doing it, right? So the big takeaway from that episode for me really is that this is a big risk and business decision and not simply a marketing tool. So great listen if you're deciding whether or not you want to offer direct billing in your clinic or even rethink your decision to do so. Number 10 was also a solo episode. This one was great. It was the employee versus independent contractor episode. Lots of chatter about it, which is fantastic. I love it when I get, DMs and emails and stuff from colleagues about an episode because it means that it's generating conversation. And that's my goal really with all of this is to generate conversation. So what I learned really is that we broke down all the different facets, all the different things that the CRA looks at when it looks at the relationship. But ultimately, the big thing is that it's not one of those areas that determines the relationship. It's the sum of the whole, right? So looking at the relationship as a whole and looking to decide whether or not what the label is matches the actual operations and reality of the relationship. So lots to consider here. Great episode if you want to learn more about that. Highly recommend it. It's probably one of my most listened to episodes. And really, I personally think it is as a conversation we need to be having more in the community. So definitely a must listen. Number 11, Andrea Burton, CEO of PABC. We had a fantastic conversation, specifically around what was happening at that time with different insurers and negotiations that were happening. But really, I think the big takeaway here is we're seeing, and Andrea's describing this as well, we're really seeing a shift in advocacy in the profession as a whole, right? Like physios have generally been a pretty quiet bunch. Like we're pretty like, yep, this is our reality. We work within it, more reactive type advocacy, but we're really seeing a shift now to a more proactive advocacy, which is a really, really cool shift. We're proactively reshaping our relationships with insurers, with government, and just seeing a lot more mobilizing within the community. So I think that's a really cool takeaway. And, if I can plug anything right now, be a PABC member if you are not. If you're a physiotherapist and you're not a BC Physio member, I would highly encourage it. There are some amazing projects happening right now that you can support through your membership. So there's my plug. Number 12 was with Joanne Bateman. This was such a cool episode. She has an amazing wealth of experience. She spent a ton of time in Uganda working in healthcare over there. But we talked a bit about that, but we also talked a lot about marketing. That's her area of expertise. And the big thing I took away from that episode is that online marketing techniques really are not necessary in physiotherapy. That pales in comparison to relationship building, right? Like some of the best marketing we can do is, grabbing a coffee with a doctor or talking to the front desk at different clinic offices, right? So developing relationships is going to pay way higher dividends than hiring an online marketing company. Really, that's my big takeaway from that one. Number 13 was with Dave Leyland. We talked, just about his journey in creating Coast as well as loaded manual therapy. And a big thing that I learned from him is that he teaches loaded manual therapy, his course in person. He has online segments with it as well. Teaching can be a really interesting career option for other streams of income for people who maybe don't want to work clinically all the time, right? I think a lot of us are really, the thought is I don't want to necessarily work clinically all the time. I want to take on more. So we move into the clinic ownership realm, which Dave has also done. But having creating a course or teaching can be actually a really fruitful and rewarding career trajectory that isn't, is different from clinic work, but isn't also clinic ownership as kind of the next natural step, right? So it's a really interesting career stream for physios or for any healthcare practitioners who are interested in, doing something different, right? And owning a business. So really cool listen on that end there. Number 14 was with Meg McPherson from Articulate Design. Fantastic episode about designing clinics and, really thoughtful clinic layout as well as brand development and whatnot. And a really fantastic thing that I learned from this one is that good design isn't just maximizing square footage. It's about creating an experience for the patient and really understanding your clientele and their needs, right? So not every square inch of a clinic needs to be maximized with like utility. It's actually more about maximizing the experience, right? So utility and experience go hand in hand. It's not just this like, we got to make sure that like there's no dead space. It's actually like thoughtful decor or a waiting area that's interactive. But understanding your clientele is the first step, and your brand identity really is the first step to shaping that experience, right? So before we even go into design, that brand identity knowing is super, super important. So that's a really great one. Number 15 was another solo episode, and I discussed how physio fees, like what we're charging patients, has really not kept pace with the expenses of running a clinic. This one is so multifaceted. There's a lot in it. It's not as simple as just like, we need to charge more. It's really about how, we talked about the service in Neil's episode, like that service of physio has become so much more elevated in many places. And the cost of delivering that has become a lot more expensive, as well as the cost of living, the cost of running a business just because of inflation, right? So there's a lot of thought that went into that one. This was actually a summary of an article that I wrote for the PABC app. So it's a little bit more nuanced here, but I think really the ultimate kind of takeaway from that one is that we need more creative solutions to being able to improve access to care for people who might not have insurance, while also being able to charge enough money to keep pace with the expenses of running a business and providing that service. So that's a little bit more complicated in terms of an episode, so I won't dive too much more into that. I'd suggest you listen to it. Number 16, this was with Anakin Chadwick. This is a brilliant, oh my gosh, she's just such a wealth of knowledge and leadership, and like I could chat with her forever. A really cool part of what we discussed is she made this really incredible matching tool on her website. And what I learned from that is that, it was really hard work up front, right? Really front-loaded process to create this tool, to integrate it. But sometimes that hard work up front can really elevate and enhance the patient experience and create better outcomes in care in the long run, right? So I think really the message I took away from that is sometimes doing really hard things, creating really hard systems, or working really hard to create something really unique can create long-term dividends that are phenomenal, right? Like the actual outcomes that patients are getting are being so much more enhanced because they've done this really thoughtful process of matching patients with clinicians, right? So, that's the example from that episode, but this can apply to so many different other areas, right? Hard work up front to create a really unique tool or operational flow or, something like that can just make things so much easier and more streamlined down the road. So hard work up front, usually done well, can pay dividends in the long term, right? So investment up front, long-term dividends. That was a big takeaway. Number 17, we had Andrea Mendoza back on the show, and we talked a lot on this one about specializing or developing a niche within physio. We discussed that, specialty is a word that we technically can't use. We can't be a specialist, but to specialize in an area is something that requires a lot of thought and a lot more consideration than, I initially thought or realized, right? So a few different ways we can specialize. We can specialize in condition or in body part. We can specialize in population, in, demographic, etc. Or we can specialize in modality, right? So some people might specialize in acupuncture or in, we might see different areas that we niche into, but the decision to pursue a specialty or a niche has a lot more considerations than we might realize, right? There's a lot more that goes into it. My chat with Andrew really exposed a lot of that. So if you are thinking about pursuing a niche, I would totally encourage you to listen to that episode with Andrea. So number 18, this was the solo episode I did on the BC corporate structure. This was another really conversation generating episode. Got lots of emails, lots of texts about this one. Quite honestly, this was an area that I learned about fairly recently myself, about the limitations that exist within our corporate permits if we are a permitted healthcare corporation. So I learned a few things from this episode. I learned that there's a lot of limitation. There's a lot of limitation to what we can do in our current legislation. And I learned that I didn't know as much about it until I did the deep dive in preparation for this. And I think there's a lot of people who are in a similar scenario, right? Like the law around general BC corporation business is what we typically refer to. But I think a lot of people didn't realize, myself included, that HPOA and formerly HPA has a whole section on healthcare permitted corporations that we maybe haven't been referencing enough. So unfortunately, there's a lot of limitation in terms of what we can and cannot bill through a healthcare permitted corporation, and anything regulated cannot go through a general corporation. So we find ourselves in a bit of a pickle when it comes to figuring out how to bill and how to structure our businesses. So I learned that there's a lot of conversation to continue having around this in the community. So reach out to me if you want to have that conversation, because that's one that I've learned a lot about, and it's certainly a challenge. So there are solutions to it, absolutely, but um, yeah, that was a real spicy one. So I encouraged that listen as well. Number 19 was with Dana Tostenson. So this was a really cool episode. He owns Pursuit Physio in Victoria, and we talked a lot about his structured mentorship program. So he has a brilliant 1 year, like formal structured mentorship program that he has all his clinicians go through. And what we talked about is that it's an amazing draw for hiring those clinicians, right? He discussed clinicians as being the biggest scaling bottleneck. It's not necessarily patients. Like lots of patients have lots of demand for physiotherapy, but the actual bottleneck is hiring, right? There's an abundance of clinics to work at. So it's kind of a therapist market. So we have to position ourselves uniquely in order to attract clinicians, right? So having an incredibly well done and structured mentorship program can be one of those beautiful add-ons that draws in great clinicians, right? So really cool episode there. Number 20 was with Vince Cunanan, our exiting PABC president. So very much gratitude and thanks to him for all his work that he's been doing there. We discussed he's a new clinic owner now and really leaned into, his belief that leading and anchoring from a place of service and love makes building a business so much easier, right? When you show up in service to your community, to your staff, to yourself, waking up and going to work every day is just so much easier than, not anchoring yourself in that mindset, right? So, he's a real breath of fresh air when it comes to just that mindset, that leadership philosophy, and just really making sure that you love what you do and that you're building a business that you love and creating an environment that fosters service and fosters love, in the community. And I thought that was a really fantastic episode just on like philosophy, right? In general. So really encourage that listen. That was a great episode. Number 21 was another solo episode. I talked about, this was more of an opinion piece, maybe a fairly strong opinion, but I talked about how I think we need to be having better conversations around the independent contractor fee split model. So there's lots of factors to consider here, but I think the big one is that, like I discussed in the fees not keeping up episode, a lot of clinics bring on independent contractors, create a contract that has them as an independent contractor. But then as costs rise and people start to panic, we start to try to control them a little bit more, which then actually encroaches on the risk, like the CRA risk of misclassification, right? So it really is a challenge to maintain that actual true contractor relationship in that model, right? Without a really healthy financial structure. The other component of it is that, the risk generally sits, the CRA definition of operational risk is what I was really specifically speaking to in that episode. Risk is a very subjective thing. And, there's a future episode next season coming around just defining risk and talking more about different types of risk. But specifically in this episode, in this example, the CRA defines operational risk as outgoing cash, basically. So an independent contractor needs to have operational overhead, some money going out on a regular basis to look like a contractor. And so in this episode, I discussed that I thought they didn't show as much operational risk in the IC split model. Now, that's certainly not perfect. There's definitely room for conversation within all of that, but my personal opinion. So really what I learned from this is that change is really challenging. And this episode brought up lots of conversation as well amongst the community. And again, more discussion to be had on this. But ultimately, I think there's more conversation to be had about reevaluating this model. And I really think that as a community, there should be, some more conversation in general, just around how we pay our clinicians. So, yeah, more to come next season around this conversation. But yeah, what I learned is that change is really hard. And I think there is an opportunity for it to start happening. So we'll see. Number 22 was with Dr. Ashley Burton. This was a super interesting story, about how she had a contract that went sideways during COVID. And the big thing I learned from this episode is that having really clear and free exit clauses in your contracts is essential, right? Where things really went sideways for her is the exit clauses required an okay from both parties, which made it, seemingly impossible at the time for her to leave because the other party wasn't, based on the story, the other party wasn't agreeing to let her go. So having really simple and clear exit clauses, I think is something that is super, super important when looking at a contract. So that's what I took away from that one amongst just hearing her story, which is wild. So definitely encourage you to listen to that one to, unfortunately hear a horror story that does happen with contracts, because I think contracts are something that maybe we take for granted sometimes, right? So really fantastic conversation there. Number 23 was with Jeff and Vanya from Physio Collective, my former colleagues and mentors. This was a really fantastic episode on leadership philosophy and emotional regulation. Masterclass, really. I learned that, quality from them, quality leadership and growth really require strong self-awareness and a willingness to be vulnerable, right? You're going to connect and support growth in your staff by being vulnerable and connecting with them on a level of, of self-awareness and emotional regulation that is really essential. Jeff spoke to his meditation practice, which I really resonate with. I really value meditation as a strong tool for emotional regulation. So yeah, leadership and growth and supporting staff really require that level. It requires a really elevated level of self-awareness and emotional regulation, and that being okay with being vulnerable, right? So really, really fantastic episode. Number 24 was with Adriana Montero. Fantastic episode about building her online business and her experience. And what I took away from this is we should all be optimizing for joy, right? She made some big decisions around her online business that I won't, I'll let you listen to the episode to find out what it is. But, optimizing for joy is so important, right? Like if we're going to start a new business, we're going to go down the road of starting a new venture or a new creative project, asking ourselves, is this bringing me joy? Is this what I want to be doing? Is huge. So really, oh my gosh, you can just feel the joy exuding from her when you talk to her. So I really encourage you to listen to that episode. It was fantastic. But optimizing all of our business choices for, does this bring me joy? Does this align with my values, is essential. So masterclass there. Number 25, we had Jason Craig from PABC discussing the diagnostic imaging scope of practice campaign that's happening right now. Fantastic episode. Jason speaks so well. What I really took away from that episode is that having legislation allow BC physios to order diagnostic imaging is really not a revolutionary thing. It's actually catching up with the rest of Canada and catching up with the rest of the world to allow physios to work at top of scope. This isn't expanding our scope. This is a catching up with what our scope really truly is. So that was really a strong takeaway from that episode. This is not new or novel. This is already happening around the world. We're behind the times and it's time for us to catch up. So I would encourage you to reach out to Jason if you want to learn more or be involved in any of the projects. He's got a call out right now for anyone who wants to be on the task force for integrating physios into primary care. So encourage you to reach out there. Number 26, a solo episode on my end. This one was about doing an internal risk audit. So what it is, why it's important, and the areas to look at. And I think really the big thing for me to take away from that one is that an internal risk audit really doesn't have to be this big scary thing. Like it's not this thing that you need to sit down and tackle and it's not, there's no like big scary threat coming in. What it is it's something that can easily be worked into regular operations, but that actually enhances your competence. It enhances your risk mitigation, and it just helps us to see where any gaps might exist and then fill them accordingly, right? So it's actually a really empowering technique. It's a really empowering process to go through. It's not this like big scary thing that has to happen like, by clockwork, right? So it's something that's really empowering as opposed to big and scary. Number 27, Melissa Thompson. She, recently started her own business. We discussed her business structure and what she's doing. And I think a big takeaway from me, she pivoted from the public system and built her business while she was on mat leave. And I think a big thing that I took away from that is, starting a business never has perfect timing. Like she did this at a time where she was, managing being on mat leave. The timing is never perfect, but the risk of doing it pales in comparison to the risk of not pursuing it, right? So for her, she had this thing, she wanted to pursue it, and she felt she couldn't stand by and not do it, right? Like the risk of not doing it was too high. She had to do it, whether the timing was perfect or not. So if the big takeaway from me there is if starting a business is something you're wanting to pursue, the timing might never be perfect, but you'll regret it if you don't try, right? So number 28, which was the most recent episode, was with Justin Chipperfield. Fantastic episode. He's a wealth of knowledge and experience. And the big thing I took away from this, and this was such a great conversation, is sometimes we are our own biggest bottlenecks, right? Sometimes stepping out of the way for our staff allows them to fully flourish, right? Sometimes we think that we have to be, finger on the pulse of everything that we're doing, or, make sure that we're like still treating and in there and doing things. And yet, sometimes when we step away or take time away from the business, we're like, oh, wow, actually, this thing was operating on its own and doing just fine without me. And in fact, doing better without me. And I need to now get out of the way so that my staff can do things, and enhance their abilities. And how can I support them in that process? Right. So that was such a great conversation. I mean, there were so many more takeaways from that one, but I really loved that recognition and that shift from like working in the business to working on the business to actually like getting out of the way entirely. That was a really cool episode. So yeah, that was all 28 episodes that we've recorded this past season. So this is number 29. And I think if I were to put a final bow on it, I've asked every single guest this season for the most part what their definition of a healthy business is. And I think, for the final point, the final learning here, if I were to summarize those answers that everyone has given me over the season, it really is a healthy business has, a culture or people that are happy. That seemed to be a huge theme. It's got really happy and healthy patients that are having great outcomes. And these are businesses that are also profitable. A healthy business has enough, cash flow, rainy day /fund to support it or to reinvest back in it, right? So a healthy business is, the way I see it is like people, patients, and profit. Healthy, happy people and culture and staff, happy, healthy patients. And it's a business that's profitable. And this opens up a whole new set of conversations that I aim to have on the podcast, next season. I think talking about money as clinic owners is something that is really important. I think there's no shame in having profitable businesses. Clinic owners take on a lot of risk. We take on a lot of responsibility. And I don't think there should be any shame in having a profitable business, not only for reinvesting in our staff, in our patients, in our facilities, but for the risk and responsibility that the clinic owner has taken on. I don't think there's any shame in paying ourselves well as clinic owners. So I think that opens up a whole new set of conversations to have, on the next season of the podcast. So with that, that's my summary. I wore my nice sparkly, my special kimono overcoat thing from Thailand to celebrate the end of the season. So now maybe time to pop a bottle and have a glass of wine to celebrate, because this has been a really fun, rewarding, and just incredible process this last season. So I'm looking forward to a bit of time off. I'm not quite sure exactly when I will be back. It's going to be probably sometime in the fall of 2026, hopefully with a whole new set of interviews, hoping to bring back some of the guests that I've already have to have, these 2.0 conversations that we talked about a lot through the season. I really look forward to doing a few more of these solo episodes. They seem to gain a lot of conversation. And I really welcome new conversations. I want to hear from you. I want to hear who you want on the podcast. I want to hear what topics you want to have visited. And really, I'm just so grateful for everyone for listening, for every guest that's given me their time on this podcast. And thank you so much for the support. So yeah, here's to season 1. Lots of learning, lots of integration, lots more to continue to reflect on, which I will do. I'm excited. I'm excited for season 2. But I'm excited for a little bit of a rest. It's a lot of work to put this content out here. And that certainly isn't a deterrent. But it's something that I just need a breather from. So yeah, we will pick back up where we left off in the fall. And in the meantime, I thank you very much for your listening and look forward to seeing you or hearing you or speaking with you over the summer and then, delivering hopefully more quality content in the fall. Thank you so much. And yeah, thanks again. That's it for this episode of The Health of Business. If you're navigating any of these challenges in your own clinic, know that you're not alone. If you're interested in working together on any of these challenges in your business, head to danielleboyd.ca to learn more about my consulting offerings and to get in touch. Catch you next time on The Health of Business.